Welcome to the Informed Woman magazine, where science meets clarity and knowledge becomes strength. I'm William Bologna. Let's make women's health understandable together.
What if cervical cancer screening could happen at home, on your own time, without a speculum? The FDA has recently approved a new at-home cervical cancer screening test that can supplement, and for some people partially replace, routine pap smears. Tests like the teal wand let people collect a vaginal sample themselves and mail it to a lab for analysis. The lab checks for high-risk human papillomavirus, or HPV, the virus responsible for most cervical cancers. Unlike a pap smear done in a clinic, this test uses a simple swab, making it more comfortable, private, and convenient. The goal is access. The FDA approved self-collection to remove barriers like discomfort, lack of time, or limited access to care. Current guidelines allow self-collected HPV testing for average-risk adults roughly ages 25 to 65. One major benefit is higher screening participation, which could catch HPV earlier and reduce cervical cancer over time. Studies show self-collected samples closely match clinician-collected ones when analyzed with sensitive molecular tests. If the HPV result is negative, screening intervals may be safely extended, similar to in-clinic HPV testing. But there are limits. This test does not look for abnormal cervical cells like a pap smear does. A positive HPV result still requires follow-up care, often a pap smear or colposcopy. It's not meant to replace traditional screening for higher-risk individuals, or those with symptoms like abnormal bleeding. It also usually requires a prescription and depends on proper collection and timely lab analysis. In short, at-home HPV testing is a major step toward more patient-centered prevention, expanding access without fully replacing the PAP smear. More options mean more people screened, and earlier detection saves lives.
Thanks for watching another video by the Informed Woman magazine. Please feel free to comment and ask questions. Subscribe for more science-driven medical insights.